The information presented in this video is for educational purposes only and should not be considered as medical advice. Always consult with a qualified healthcare professional before making any changes to your diet, exercise, routine, or health practices. The content is based on personal experiences and research, but it may not be suitable for everyone. Neither the presenter, myself, nor this channel is responsible for any adverse effects or outcomes resulting from the use of the information provided. Please do your own research and consult a professional for any specific health concerns. There are numerous tests that can be used to diagnose a vagus nerve dysfunction. We're talking about vagus nerve impairment or neuropathy. This can also include damage and compression syndromes. One of the first tests that are done is a vagus nerve ultrasound. This can be done in the cervical spine, in and around the sternocleidomastoid and trachea region. It can pick up on any change in the structure of the vagus nerve and the diameter. This is often termed as vagus nerve inflammation, and many incorrectly attribute it to autoimmunity, but in fact inflammation is a suggestion that there is damage and the body is trying to repair it. Another way that you can look at vagus nerve is basically through function. You can do electrodiagnostic testing or stimulation reading testing, which is essentially where you use some kind of stimulation. Sometimes it's electrical, sometimes it's vibrational, and you stimulate the vagus nerve at a cephalid level and read it caudally, either in the gut or in the heart, and see whether there's any changes in heart rate or gut motility. Another way that often people look at the vagus nerve is through some of its secondary nerves. One is called the laryngeal nerve. Through a laryngeal EMG, this test basically looks at how much electrical activity is going on in the vocal cords. Another test we often use is heart rate variability. Although this is a measurement of general autonomic function, it can also indicate vagal function. And I like to use this as sort of a well-rounded approach to measuring cardiac vagal tone, long term rather than the short term. Sometimes you can also look at heart rate and blood pressure can also indicate whether someone's leaning towards low vagal tone or hypervagal states. And gastric emptying tests are used more and more now to diagnose gastroparesis. That's where we measure how much or how fast the food moves through the stomach into the duodenum. Another one is the barium swallow. That's used to diagnose any aberrations in swallowing methods or changes in electrical activity in the esophagus. Sometimes it'll pick up aberrant or overactive esophageal activity or underactive, and again that can be attributed to the vagus nerve. The Valsalva maneuver can be used to measure changes in heart rate and also blood pressure. If the vagus nerve is working properly, that is the cardiac and other vagal fibers that go to blood pressure receptors, baroreceptors and things like that, you're going to see a change in the blood pressure almost within 10 seconds with this test, and it's a useful test that can be done clinically. And finally, the dynamic cervical X-ray. Now this is to pick up any instability in the neck, and it's often attributed to this problem of instability when you have vagus nerve dysfunction and compression. So it's a useful test. I will say that with brain MRIs, they can be useful to pick up things like Chiari malformation and things like that, other conditions that aren't specifically vagus nerve, but they're more so to pick up those more cephalid problems rather than distal vagal problems.